Hi, good morning. In this seminar, we are going to see about the wound and its types. First, definition for wound. The wound is a break in the integrity of the skin or tissue, often which may be associated with disruption of the structure and function. A cut or break in the continuity of any tissue is caused by injury or operation. Next we will see the classification of wound is classified based on according to the status of skin integrity, according to cost of the wound, according to severity of injury, according to cleanliness, according to descriptive quality. According to the status of the skin integrity, closed end and open wound, it is one in which there is no breakage in the continuity skin or mucous membrane. Example, hematoma and fracture of femur. Open wounds, it is one in which there is a destruction of the skin or mucous membrane, thus exposing underlying tissues to the opener. Example, incision, vein puncture and burns. Next, according to the cause of the wound, first is intentional or surgical wound. It is the one which is produced for the specific purpose, usually under aseptic precautions. Example, surgical incision. The next is traumatic or accidental wound. It is the one which occurs by accident. Example, knife wound or burn. Next, according to severity of injury, for superficial wound, it is the one in which only the epidermal skin is involved. Example, abrasion and first degree burn. Next is penetrating wound. It is one in which there is a breakage in the epidermal layers of the skin, dermis, and deeper tissues or organ. Example, bullet which enters the chest and lodges in the lungs. The next, perforating wound is one in which the foreign objects or instrument cuts open the whole thickness of the wall of the cavity or organ. The object enters and exits an internal organ. Example, gunshot wound. Puncture wound, it is the one in which there is injury to the deep tissues, but there is only a very small opening on the surface. Example, sharp point instrumental injury. Next, according to the cleanness, clean wounds is one which does contain pathogenic organism. Example, thyroidectomy and mastectomy and lipomyxin. Next, clean contaminated wound, low inflammation, infection present, minor breakage in sterile technique. Example, simple appendectomy, prostatectomy, and cholecystectomy. Next, contaminated wound versus traumatic wound or acute inflammation present. Major break in sterile technique, cross contamination from respiratory, gastrointestinal or genitourinary tracts. Example, traumatic wounds, colectomy with belly leak. Next, infected organisms present at the surgical site prior to the procedure, perforation, gastrointestinal, respiratory, and genitourinary tract. Example, appendial abscesses and peritonitis. Colonized wound, it's example, pressure sore. Next, according to the descriptive quality, lacquerate wound is usually has irregular edges. Example, cut by a glass. Next is abrade wound. It is a superficial wound involving scraping or rubbing of the skin surface by friction. Example, fall on floor. Next, contused or closed wound. In this, there is no breakage in the skin. Externally, wound is capped by swelling and discoloration and pain. Example, blunt trauma. Next is incise wound. A wound is a clean cut and has a smooth regular edges that can be approximated. Example, wound made during surgery. Uh, in this PPT we discussed about what is the wound, and different types of wound according to the many categories. In the next 50 we discuss about the different stages involved in the wound healing. Thank you.